earlier this week when President Trump tweeted that Republicans would be better for patients with pre-existing conditions than Democrats, I nearly fell out of my chair. It's time we set the record straight. By some counts, since President Trump took office, between 3 and 4 million Americans have already lost their health care coverage, and that comes from the Commonwealth Fund. Under the president's watch, healthcare costs are rising, prescription drug prices are soaring, and the protections guaranteed to patients under the Affordable Care Act are constantly under attack. And Republicans in Congress have been complicit in this every step of the way. They did absolutely nothing when the president halved the open enrollment period, which is critical to trying to get people to sign up, as we have an open enrollment period that begins today. As the congressman said, insurance is about spreading risk over the widest pool possible. Getting more people into the system is critical for their lives, for their family lives, for the efficiency and effectiveness of the fund as a whole. But the president halved the time of the open enrollment period, leaving folks less time to get covered. He gave less resources to actually create coverage, navigators, which I heralded as part of the law when I helped write it. They did absolutely nothing when the president ended the cost-sharing payments that are called for in the law that help low-income Americans access low-deductible health plans. And they absolutely did nothing when the administration announced that it would argue that protections for pre-existing conditions are unconstitutional in court. As we speak in a federal court in Texas, the administration has had the Department of Justice argue that the law is unconstitutional. Now, I am proud as one of the authors of the Affordable Care Act that nearly 1 million New Jerseyans got health care who didn't have it before. 3.8 million New Jerseyans who have a pre-existing condition, some illness that they contracted in life, Parkinson's, breast cancer, a child born at birth with a birth defect, who were barred before the law from getting health care by insurance companies, can no longer be discriminated against. I am proud that we eliminated lifetime caps under the law, which basically meant you had insurance, even if you had insurance, you had a serious illness, you hit the ceiling on the coverage of that insurance, you went over that ceiling, you were on your own. You were one illness away from bankruptcy. I'm proud that we eliminated discrimination against women who were charged twice as much as their male counterpart in the same age group, in the same geography, simply because they were a woman. Or as the congressman said, that pregnancy was a pre-existing condition, or that we were able to keep our children to the age of 26 on our health care as they made their own way in life. All of these things and so much more. Essential health benefits, a special package of health benefits for women. As the women senators told me when we were writing a law, you know, yes, health care for everybody, but we have some unique issues and we want this to be written into the law. They were. All of this is under attack by the administration. All of the coverage, all of the protections, all of the progress. So that's 3.8 million Americans in New Jersey. It's 52 million people across our country. So I can tell you as one of the authors of the Affordable Care Act that it's no exaggeration to say that protections for patients with pre-existing conditions is the heart and soul of the Affordable Care Act. And yet my colleagues, my Republican colleagues, are standing idly by as the Trump administration tries to dig a stake right through the heart of it. It is the most popular provision of the health care law for a reason. Everyone remembers what it was before the Affordable Care Act. It wasn't so long ago that Americans lived in constant fear of a health insurance company denying them coverage or to drop them from the policy simply because they had a pre-existing condition, like a heart defect when they were born, a chronic condition like diabetes that they struggle with, or a battle with cancer that they were fortunate enough to win. We were living a nightmare for those who had any of these pre-existing conditions. A nightmare that left millions of families in bankruptcy. One of the largest rates of bankruptcy in our state and our country was from medical bills that could not be paid. A nightmare that we Democrats ended in 2010 when we worked with President Obama to pass the Affordable Care Act and ban discrimination against pre-existing conditions. So I'm proud of the gains that we delivered to New Jersey. Not a perfect law. More needs to be done. We need to build upon it. But it also moved our healthcare system, or attempted to begin to move it from a disease-based system, which is you go when you're ill, to one that was preventative at the end of the day. Preventative in terms of trying to make sure when you're healthy, best time to go and make sure you stay healthy and healthier in your life, more productive for you, less costly for the system. For nearly 500,000 low-income residents that were now covered by the expansion of Medicaid. And these are people who get up, work hard every day, work at some of the toughest jobs in our state, but don't get insurance at work, don't have enough money to buy insurance. So it's not the poor. It's people who get up and work every day. And Medicaid expansion brought nearly 500,000 residents in New Jersey coverage. And nearly 400,000 were able to enroll in private insurance coverage through the marketplace, the vast majority who were also eligible for tax credits that reduced their monthly premiums. So all of these benefits, I think it's tougher to slay something when more people are in it. And today is the beginning of the enrollment period, an opportunity to get coverage, an opportunity in most cases that we have experienced in our state where people can actually get credits, tax credits towards the coverage, and it can help them enroll. And we have that period until December 15th. And I would just urge everyone and there are plenty of institutions that are helping in our state. The governor has launched a website that I think is critically important to help us, and I think that's all necessary to maximize the number of people who will get health care coverage. And I think the more people who get health care coverage, not only will they be healthier, but will also strengthen the system at the end of the day. But too often we forget that the Affordable Care Act wasn't just about helping the uninsured get coverage. It was also protecting people who already had health care coverage, even in the private sector, including 4 million or so here in New Jersey who were covered by their employers. The ACA put an end to some of the worst abuses of the private health insurance industry. I'm talking about babies born with heart malformations who hit lifetime limits on their coverage just as their lives were getting started. I'm talking about those pre-existing conditions that we mentioned before, who would bump into the annual caps and be slammed with massive out-of-pocket medical bills. I'm talking about working people who can now actually rest assured that their health care plans actually cover essential health care benefits like visits to specialists, maternity care, prescription drugs, mental health services, and more. So I just want to have us make a call as we have this national debate that there's no mistake behind the scenes and now in federal courts. The administration is doing everything it can to bring us back to a day when health insurance companies got to pick and choose who was worthy of receiving care and who wasn't worth it at all. This is serious stuff. The administration's decision to abandon people with pre-existing conditions just isn't a flip-flop. It's a broken promise that leads to broken families and broken hearts. That's what we're fighting against. That's what we're fighting to preserve that which we build. And we'd love to be able to build upon it. That's the work that still remains, and we're not going to stop until every man, woman, and child in our state and in our country have access to high-quality, affordable care.